So, the response to the shortage of trained medical staff, let's just talk about what research says. It says that on average, only one doctor is available for every 1,000 people. Now, in response to this, the Unjani Clinics announced a partnership with Johnson & Johnson to continue to improve the access and quality of primary health care available to low-income communities throughout South Africa. The Unjani model focuses on increasing training and business resources to nurses, as well as expanding access to affordable primary health care services. From Unjani, we are joined by Lynda Toussaint, who is the CEO of Unjani Clinics. It's good to have you. Welcome to the program.
Thank you so much, Leanne.
So yesterday was a big day for you. You had a wonderful cash injection. Talk to us about this.
Absolutely. So the Unjani concept is really about empowering black women, professional nurses, to own and operate their own primary healthcare clinics in the township communities. Up until now, the Imperial Group has funded the first 25 clinics in the network.
Yeah.
Johnson & Johnson have come on board to help us to probably open another 10 to 12 clinics over the next few years.
That seriously is something, this is something that we talk about when we talk about those public-private partnerships that are needed. You could never have done this without this fuel injection.
Absolutely, because really what this is it's about almost a donation of a clinic that empowers the nurse to actually own and operate her own business in her community. And as a result of that funding, we're able to achieve that.
All right, so let's go back to the beginning now, because we got the great news there. Now let's talk about the hard work that's being done in this Unjani Initiative. Where did it all start? How did this begin?
So it all started about 6 years ago. In 2010, the concept was initiated, really checking concepts. We then went into pilot phase where we started looking at 6 clinics and we managed those until 2014. From the learnings in our pilots, we then opened a further number of clinics, and we now have 20 clinics in the network, in and around mainly the Gauteng area, but we're expanding, and our dream is 50 clinics in 5 years, so by the end of 2018 to have 50 clinics in the network.
That'll be absolutely incredible if you do this. So, with this injection, as you say, there are going to be another 10 clinics coming on. So in total,
we'll have, in total, we'll have about 40
You'll
by
have
that
40,
stage.
so,
yes.
You're almost there.
Yeah, absolutely.
You're almost there, and it just takes another a generous donation, and you'll be able to do it. How does it work, though? You say that the nurses own and run it.
Yes.
How does this whole thing work?
So the nurses go through quite a stringent selection process. All of our nurses are professional nurses with dispensing certificates. So to your point around the research and the shortage of medical staff, what we're trying to do is relieve the strain on the number of doctors that are available in South Africa and utilise our professional nurses to provide primary health care.
Yeah.
And so they are selected through the process and we then donate a primary health care clinic to them in the area of their choice. And we then, through a 5-year enterprise development initiative or agreement, train them to become sustainable businesses. So the non-profit company that I run actually is assisting them in training, support, operations, and ultimately after 5 years they're then able to own and operate a clinic that is sustainable, it employs people, and it's a business for the nurses.
If you go and visit these clinics, is it for just checkups, common ailments? What do you do at these clinics if you're a patient?
It's generally primary health care, all your primary health care issues. So anything from a gastro through to flu, through to HIV testing. So it's general primary health care, obviously within the scope of practice of a nurse.
Yes.
After which she then refers into the doctor network. So vision screening, health, baby wellness, the clinics provide all of those services.
Vaccinations, absolutely everything. You come to these places. Now, how is it determined? I know you said that the nurses kind of say, we want it here. Do you do research into the area, though? What is the sort of thing that you're looking for?
Well, in conjunction with the nurse, we would be doing research. So the nurse actually goes into her community of her choice and does a survey of the community to see whether there would be a need for the clinic. Would they support the clinic? Because again, it's a paid-for model, so it's not a free service. Then we do research to make sure that are there other healthcare facilities in the area. Where's the closest government clinic? Because what we're trying to do here is we're trying to relieve the government clinics of the strain of the people that are actually able to pay something nothing towards their primary health care.
Okay, so you say it is paid for. I mean, on general, what would a patient pay?
Well, 180 Rand, including the cost of the medication. So that's the consultation, including the cost of the medication for the treatment of the condition.
And that's really, I mean,
it's affordable.
It is affordable, and it's something where if you go to so many clinics, and I mean, you and I both, everybody's heard horror stories and been through really tough times going to these hospitals where you sometimes for days you sit there waiting and
yes.
by that time it's either too late or you're just not getting help there. So for 180 Rand you get medication and the service all included into this cost.
And in your community.
Now, if we talk about this sort of spreading to other areas, I mean, at the moment you're primarily focusing in on Gauteng.
Yes.
Is there a plan to make this a nationwide thing?
Absolutely. So we will expand into the other provinces. We're looking at Limpopo and Mpumalanga next, the Northwest Province, and then further out into KwaZulu-Natal, Eastern Cape.
Yeah. If people want to get involved, if people want to help, how do we get hold of you?
Well, it's a fantastic opportunity to be here. So, if we could get Imperial Group and the Johnson & Johnson family of businesses to get involved. We'd like many, many more corporates to get involved. It is an enterprise development initiative. Enterprise development funding is utilised for it. So you can contact me on my email address. It's ltoussaint@unjani.org. Alternatively, our website is www.unjani.info.
Unjani.info. Okay, all right, we'll give that one out. Just before I let you go, I mean, in terms of employment, this must be quite a great employing communities.
Yeah. It is fantastic. So it is creating employment. The nurse is obviously running a business and she's employing people in the clinic to assist her. Generally, it starts out with just 3 employees, but it expands as the patient numbers increase in the clinics. But it is a job creation initiative too.
Fantastic initiative. It really is. Unjani, it's Unjani Clinics. They're in different communities around, particularly Gauteng at this point. They've just got a wonderful cash injection that they're able to open up more clinics there. By the end of the startup with this funds, they'll be able to have 40 clinics servicing these communities and hoping to go nationwide. And I love the buildings. I mean, what is the structure?
So it's a 12-metre container that's been converted.
So it's containers converted into clinics?
Yes.
That's something we haven't spoken about.
Yeah.
I mean, there's so many things that these initiatives, whether it be libraries or clinics or hostels, you name it, being used for containers.
Absolutely. It's a fantastic recycling initiative.
Really. How much does one cost? If a company wants to open up one, what does one clinic cost?
So we look at it in a 5-year investment because it is a 5-year investment in the nurse in that 5-year enterprise development the agreement. So it's R1 million.
1 million for it. And that, you get your medication from where? Is that from the department?
No. So because it is a private model, the medication is acquired through the private wholesalers and manufacturers in South Africa.
All right. Well, there you go. That's all the information you need, I imagine, at this time. Unjani Clinics servicing communities, and hopefully it's going to be a nationwide thing to try and assist and alleviate the pressure on public hospitals. Talking to us about this was Lynda Toussaint. She's the CEO of Unjani Clinics. Visit their website, www.unjani.info, and you'll be able to find out all the details there and perhaps make contact with them. Thanks, Lynda.
Thank you.
Good luck going forward. Thank you very, very much. Let's take a break. We'll see you after this. Stay tuned.